We have muscles on our face that allow us to make facial expressions. Cutaneous muscle, a muscle that inserts on the skin rather than a bone. We contract to make facial expressions. Cutaneous means skin. They are the muscles that have an origin on a bone and has its insertion on the skin. We have plenty of cutaneous muscles that make up our facial features. The frontalis muscle will elevate the eyebrows. It is named after the fact that it's found sitting on top of the frontal bone. So, to feel your frontalis, you will want to raise your eyebrows. You should be able to feel those frontalis muscles. A fun fact, when we do brain surgery, we cut through the frontalis muscle and flip the scalp back. We don't cut straight down on top of a person's head because at the top of the person's head is the tendinous structure. It's made up of dense regular and dense irregular connective tissue, and those don't heal well, but muscle heals really well. In order to have a fast healing process, we need to cut through the frontalis. Here, I am using the frontalis muscle to raise my eyebrows. The frontalis muscle, its action is that it raises eyebrows. Next, I am using the orbicularis oculi. That muscle, its action is that it closes eyes and squinting. I am now using the risorius muscle. Its action is that it moves the corner of the mouth laterally, and that is the muscle we use when we fake smile. The next muscle I will be using is the zygomaticus. It is going to elevate the corner of mouth, and that is the muscle we use for when we are smiling. The next muscle is the orbicularis oris. Its action is that it closes lips and it protrudes lips. This is the muscle you use for when you are doing duck faces for your selfies. Here I will be demonstrating the two muscles of mastication that are a part of our mastication process. Right now I am flexing my masseter by clenching my jaw. The masseter and the temporalis muscle both have the action of elevating our mandible and closing our jaw. We use those muscles to chew our food and to eat our food. An acronym that I like to use to remember the rotator cuff muscles is the acronym SITS. The humerus sits in the glenoid fossa. The S in SITS stands for the supraspinatus muscle. The I in SITS stands for the infraspinatus muscle. The T in SITS stands for the teres minor, and the S stands for subscapularis. Here I am going to demonstrate the triceps brachii being contracted. Next, I am going to demonstrate the biceps brachii being contracted. In between the biceps brachii and the triceps brachii is a brachialis. We have three muscles of the arm. I am demonstrating the triceps brachii. Its origin is the humerus and scapula. Insertion is the olecranon process of ulna, and its action is that it extends elbow. Next, I'm going to demonstrate the last two muscles of the arm using my live model. We have the biceps brachii that's going to contract. Its origin is the scapula. Its insertion is the radial tuberosity of the radius, and its action is that it flexes the elbow. We also have the brachialis. Its origin is the humerus. Its insertion is the coronoid process of ulna, and its action is also that it flexes the elbow. The brachialis can be found in between the biceps brachii and the triceps brachii. The triceps brachii will extend the elbow, while the biceps brachii and the brachialis both flex the elbow. An acronym that I like to use to remember the anterior flexor muscles of the forearm is this: can't really come until day 6. The C in can't stands for the flexor carpi radialis. The R in really stands for the extensor carpi radialis. The C in come stands for the flexor carpi ulnaris. The U in until stands for the extensor carpi ulnaris. The D in day stands for the extensor digitorum, and the S in 6 stands for the flexor digitorum superficialis. And that is how I remember 6 of the muscles of the forearm out of 9. To be able to see your palmaris longus, you're going to want to have your arm out and have your pinky and thumb touch, and then you're going to squeeze and contract as hard as you can to be able to see your palmaris longus. The palmaris longus origin is the medial epicondyle of humerus. Its insertion is the palmar aponeurosis. Its action is that it flexes wrists, however, it does it weakly. It is a long tendon that reaches all the way up and goes into the palms. It is a vestigial structure. Technically, we don't need it because it's very thin and tiny compared to the other carpal flexors. If you rupture a tendon or ligament, and a surgeon needs to get some sort of tendon to replace the one you ruptured, they can take out the palmaris longus, its tendon, and use it to replace whatever you broke. 80% of our population don't have a palmaris longus. Some people have it in one hand but not the other hand. We won't need an additional tiny muscle that won't do as much. People who don't have it are evolutionary adapted, and people that do have spare parts. An acronym that I find helpful to remember 4 out of 9 muscles of the forearm is PUF PUF, PF. You're going to want to have your forearm out, and with the other hand, bring your 4 fingers over to that forearm. The index finger will represent the pronator teres muscle. The middle finger will represent the flexor carpi radialis muscle. Your other finger will represent the palmaris longus, and your pinky will represent the flexor carpi ulnaris. Here you can see the muscles of the forearm that I just talked about a lot better on this model because this model exercises regularly. A person who exercises regularly, their muscle fiber will grow and they will have less fat, so you're able to see the muscles a lot better even through the skin. You can even see his vein. The pronator teres, its origin is ulna, insertion radius, action pronates forearm. Next muscle is the flexor carpi radialis. Its origin is medial epicondyle of humerus, insertion is base of metacarpals, and action is flex wrist and abduct wrist. Next, we have the palmaris longus. Its origin is medial epicondyle of humerus, insertion palmar aponeurosis, and action is flexus wrist weakly. Then we have the flexor carpi ulnaris. Its origin is medial epicondyle of humerus, insertion is base of metacarpal 4, and action is that it flexes wrist and abducts wrist. If you want to grow your pectoralis major, push-up works out the pectoralis major, so that is a great exercise to implement. Pectoralis major is also known as your pecs. They are going to flex the arm and abduct the arm. These muscles are in the pectoral region, which is known as the pectoralis. It is called pectoralis major because it's bigger than the pectoralis minor, the other pectoralis. It is an example of a convergent muscle. Deep to the pectoralis major is the pectoralis minor. The pectoralis major origin is the sternum and upper costal cartilages. Its insertion is the intertubercular groove of humerus, and its action is to flex the shoulder and abduct the shoulder. We have 2 muscles that we need to know of the pectoral girdle. First is the trapezius. The trapezoid-shaped muscle is on the posterior side. It is a very thin muscle. Its origin is the thoracic and cervical vertebrae and the occipital bone. Its insertion is the spinal scapula and the clavicle. Its action is that it rotates scapula and retracts the scapula. Deep to the trapezius is the rhomboideus muscle. The rhomboideus muscle is 2 separate muscles, the rhomboid major and the rhomboid minor. No need to identify them individually. It is called rhomboideus because it is a rhombus-shaped muscle. Its origin is the thoracic vertebrae, its insertion is the medial border of scapula, and its action is that it stabilizes scapula and retracts the scapula. Here, you could also see the latissimus dorsi muscle. Latissimus means fraud. Dorsi means the dorsal side, back side. It is the primary extensor of the arm. Latissimus dorsi is also known as the swimmer muscle. When you freestyle, bringing your arms back causes your latissimus dorsi to contract. The latissimus dorsi origin is the thoracic and lumbar vertebrae. Its insertion is the intertubercular groove of humerus, and its action is that it extends shoulder, and it is the primary mover. A muscle that catches my eye that I found interesting, and it is emphasized that will be on the exam by the professor, is the serratus anterior. The serratus anterior is known as the boxer's muscle. It is the muscle that points towards the anterior side. The muscle looks like a set of teeth, like a serrated knife. It has the primary action of protracting the scapula. To see your serratus anterior, you will want to push your arms forward. This is known as the boxer's muscle because boxers use this muscle a lot. Boxers are doing their stance. The serratus anterior is robust. It can also have a second action. If you raise your arm, it causes the serratus anterior to pull on the origin and causes the ribs to be pulled, and it allows your thoracic cavity to have a larger volume. These muscles give two different actions even though the ribs are the origin.